Here are 3 patient assessment mistakes that EMT students and newer EMTs make all the time. So if you stay till the end of this video, you're really going to understand some common mistakes that I see pop up all the time with EMT students, and especially newer EMTs that are out in the field assessing patients. And if you're aware of these mistakes, it makes it easier not to make them, both in testing and in practice. So my name's Dave and I'm a paramedic, and I make these videos to help EMT students, newer EMTs, and paramedic students pass their exams and feel more confident, prepared to go out on the job and work with patients. So what are these 3 patient assessment mistakes? Well, number 1 is disorganization. We all pretty much learn patient assessment the same way. A medical patient assessment in all the books and on the National Registry testing sheets or skill sheets are all pretty much laid out the same exact way. We do a scene survey, we do a primary assessment, we do vital signs, we do a secondary assessment. And we're all taught to do this the same way because it works and it makes sense. And later down the line, you can develop your own kind of framework for how you want to do it. But when you're new or when you're preparing to test, it's important that you know the framework step by step and how to work through it methodically, and it'll really make your life much easier. For example, I was with a paramedic student recently that was very good, but didn't have a methodical way to work through his patient assessment. And he jumped around a lot and kind of asked the same questions over and over again, which would normally be fine because it takes time to get good at this stuff. But we had one patient who was mildly intoxicated with a psych history, who was kind of also dealing with some psych problems that night. And this paramedic student was kind of asking the same questions over and over again. And what I noticed and have noticed in the past is that normally for patients, it's not a big deal, right? They understand that people have to learn. But because this guy was a little intoxicated and had a psych history, he was getting really agitated with the student. Towards the end of the call, he wasn't just agitated with the student, he was agitated towards everybody, right? So it's not to make anybody nervous or make you have fear about making mistakes, but it's just an extreme example of why we kind of want to have a process that we work through when we are assessing a patient and asking questions, and it'll also ensure that you do well on your test. So mistake number 2 is not immediately fixing problems as they arise. As you move through your patient assessment, you're going to notice problems with your patient. So if you're doing your primary assessment, airway, breathing, circulation, you might go through and do an airway assessment and everything's fine. You get to your breathing assessment and the patient is in respiratory distress. So the first thing that you want to do when you notice that is put the patient on oxygen. So instead of moving through your entire primary assessment first and then applying oxygen after, it's important to fix these problems as soon as they arise. It'll ensure that you don't get tunnel visioned later and forget to do something, and it'll also make sure that you do not hit any critical fails while you're testing. So make sure once you see a problem, you fix it immediately. Mistake number 3 is not reassessing your patient. So it's really important in both testing and practice that after we move through our assessment, when we get to the end, that we're reassessing our patients. So for example, a critical patient needs to be reassessed every 5 minutes. And that's because patients' conditions change over time. So if you have a patient you're suspecting maybe has internal bleeding and you obtain a blood pressure initially, in 5 to 10 minutes, that patient might not have a blood pressure. It might be really low. Anything that you can intervene with and interventions you can provide to your patient, you can do them when you notice the change, or it's important to know trending vital signs and the patient's condition to relay that information to the hospital when you get there. For testing, it's also part of the algorithm to make sure that we're reassessing our patient after we go through the entire patient assessment, so you don't want to fail because you're not reassessing your patient. So those are the 3 mistakes that I often see with EMT students. Number 1 is disorganization. So make sure that you are organized and you have your assessment memorized. Number 2 is not immediately fixing problems when they arise. If somebody needs oxygen, give them oxygen immediately. Number 3 is, again, forgetting to repeat the assessment. Once you go through your entire assessment, make sure that you're repeating your assessment, you're getting vital signs again, and you're doing this through the entire patient contact until you deliver that patient at the hospital. It's extremely important that when you're preparing to test that you know all the critical fails, because a lot of the critical fails are mistakes that a lot of people make. So know your critical fails, know common mistakes, and practice. Repetition is going to be your best friend with the various skill sheets that you need in order to pass your EMT exam. So what mistakes do you find that you're making often, either when you're practicing your patient assessment or if you have had clinical time where you've worked with patients? If you have any common mistakes that you make, let me know what they are down below. And here you can check out some additional videos that are going to be helpful for you. Thanks for watching.